My name is Jared Foran. I'm an orthopedic surgeon here at Panorama. I do hip and knee replacements. So we're going to talk today about partial knee replacements, otherwise known as a unicompartmental knee replacement. So a little bit of anatomy of a knee. A knee has three compartments to it. The compartments are we define as areas where cartilage on one side of the joint touches cartilage on the other side of the joint. So there's three areas in a normal joint. There's the medial compartment, which is on the inside part of your knee. There's the lateral compartment, which is on the outside part of your knee. And the third compartment is the one that's underneath the kneecap, where the kneecap rubs on the knee there, okay? So if two of the three compartments are worn out, or all three compartments are worn out, it makes sense to do what's called a total knee replacement. If you're a person that has partial wear to your knee, or unicompartmental wear in only one compartment, such as this person here in this x-ray, then you could potentially be a candidate for a partial knee replacement. Just replace the part that's worn out. The other type of partial knee replacement is what's called a patellofemoral replacement, where you just replace the part of the knee where the kneecap rubs, leaving the main weight-bearing part alone. The advantages to a partial knee replacement are several. First, it's a faster, easier recovery. It tends to be less risk of infection and blood clots, etc. But the most important advantage to a partial knee replacement is that it saves 2/3 of your knee, including all of your ligaments, so it tends to feel more like a natural, normal knee. There's a lot of concern that people have. Well, it's called a partial knee replacement, therefore it's not going to last a long time, or it's a partial solution. Actually, a partial knee replacement is not a partial solution at all. It's a total solution to a partial problem. But these can absolutely last just as long as a total knee replacement. So it's always possible, if we're leaving the other surfaces unresurfaced, they can wear down with time. For the vast majority of people, that's not going to happen, particularly if we pick the patient correctly. But assuming that it does, in 10 or 15 or 20 years, the other part wears down, you can easily convert this to a total knee replacement. So who is the right candidate for a partial knee replacement? If you look at numbers, then studies been done, probably somewhere between 30–40% of people actually are candidates for partial knee replacements. A lot of times patients that have had injuries leading to arthritis is very often unicompartmental arthritis, because they've injured one side of their knee or the meniscus or ligament. So typically those patients are very good candidates for a partial knee because they're not naturally prone to arthritis. It's not part of their genetics. That happened to them because it's an injury leading to post-traumatic arthritis. And if it's one compartment's worn out, then they can do very, very well with a partial knee replacement. So how long is a knee replacement going to last? It's a hard question to answer definitively for any given person, but if you look at averages, at 15 years of follow-up, well over 90% of knees are doing well in modern studies. At 20 years, it's probably 80–85%, give or take. At 30 years, it's up to 70% are still doing well. So there's certainly a small rate of failure over time, but they can last a long, long time, and for some people they're going to last forever. So the recovery from a partial knee replacement is generally a lot easier than a total knee replacement. I would say at least half, maybe even better than half the sort of recovery. Patients typically either go home the same day from surgery or spend the night in the hospital, putting full weight on it right away as much as you want. Use a cane, use a walker, you can get rid of those whenever you want. Usually by 6 weeks, people are about 75% recovered. I have people golfing and doing very active things at 6 weeks. By 3 months, you're about 90%. The biggest thing about partial knee replacements is there's a lot of misinformation. There's a lot of people, both doctors and patients' friends, that say, oh, don't do a partial because it's only going to last, it's not a full solution, you should do the whole thing. There's really distinct advantages to a partial. I think a partial, and many people that do a lot of partials believe, because we know how patients do, it's a superior operation to a total knee replacement. It's a knee that feels better than a total knee in general. It acts more like a natural knee, and it preserves your own bone and cartilage, and all your ligaments. So if you're a candidate for a partial, I think patients should really look at that as an option.